I was high school principal once, so I can speak from experience that in a thriving school, you've got active students and you have active parents. And when parents are working two jobs, struggling to maintain their home, and in this case, also struggling with policy changes, involving parents means reducing barriers for parents being active in the school.
The education landscape is constantly evolving. Staying ahead of the trends is essential. Welcome to Ed Buzz LA County, where we explore groundbreaking initiatives, inspiring stories, and innovative practices shaping the future of learning here in Southern California. Today, we're highlighting several public health programs designed to empower youth, support families, and improve school communities. I'm Dr. Elizabeth Graswich, and I'm joined now by Dr. Debra Duardo, Los Angeles County Superintendent of Schools, and Dr. Barbara Ferrer, who is the Director of the Los Angeles County Department of Public Health. Welcome to you both.
Thank you.
Thank you.
We are going to start off with a subject that is close to both of your hearts, which is youth councils. You each have one. Dr. Ferrer, can you share a little bit about yours?
Yeah, and thank you so much. It's such an honor to be here with Dr. Duardo and with you. I think the reason we're both going to talk about our councils, our youth councils, is because they're so important. One of the most effective ways for us to both understand the young people that we're working with and respect the young people that we're working with is to give them voice. I know we talk a lot about empowerment, but empowerment really is about respect and voice, and creating opportunities for young people to step up, be leaders, work with their peers, and help influence the communities in which they're living, going to school, and for some of them working. Our youth council is set up really to advise us as a department on what kind of programming is most appropriate for us to use in supporting young people. We have a heavy focus on really helping young people be healthy and safe. So our youth council is both trained and versed in talking with us about issues related to substance use, both prevention and treatment. They're really super interested in and conversed in talking to us about mental health and emotional well-being. And they're also very focused on what can they do to influence the communities in which they live, including their schools. The kind of advice we get from them ranges from helping us launch a campaign specific to young people around, for example, addressing issues related to vaping, to helping us design a program in our schools that allows young people to be peer health advocates.
And Dr. Duardo, I mean, you've also been a huge advocate of student voice. Why does it matter so much?
I mean, it's critical. But before I even go there, I have to say I'm so excited to have Dr. Ferrer on the show.
Yes.
And also just to tell you, I mean, I still hear from superintendents that have so much gratitude for all of your support during the pandemic. I mean, the way you came and supported and met with us weekly is really impressive. But going back to the Student Advisory Council, it's exactly what Dr. Ferrer said. One, we want to hear from students. You know, it's their lives. They should be empowered to be able to speak to what are the things that are relevant to them, what's important. We have to make decisions every day about where we want to place our limited resources, how we want to approach our work, and how we're going to be most effective. And so for us, it's really important to hear from students and have them tell us, this is what we care about. This is what we're hearing from our peers. These are some of the solutions that we think would really make a difference. These are the areas that we want to focus on. So it's really about allowing or empowering our students to tell us what it is they need and how they want us to best serve them so that we can be most effective.
Well, and I think the power of listening is so important in our work in both education and public health and the intersection of them, right? And so like another area in which you're doing, I know, a lot of listening as well as empowering people with correct information is the PALS program. Can you share a little bit about that program?
The PALS program is really a parent-focused, parent-centered program where we encourage our parents to be leaders in their school community. It's very focused on schools. It's throughout the county. We provide both training to the parents, but just as importantly, we see them as leaders in their community and as peers to involving other parents in school-focused initiatives. Now, this can range from bringing parents together to better understand issues related to substance use and harm reduction amongst young people. It can also be bringing parents together with administrators in the school community to talk about making some changes in the school community that actually support families. Right now, we've also had a very big focus on protecting families from immigration raids and helping them really be able to talk to each other about what are the resources available on how to create as much safety as possible at schools and in their community. I was a high school principal once, so I can speak from experience that in a thriving school, you've got active students and you have active parents. And when parents are working two jobs, struggling to maintain their home, and in this case, also struggling with policy changes. Involving parents means reducing barriers for parents being active in the school. One thing about that PALS program is it reaches parents where they're at and then allows other parents to figure out what are the best ways to invite parents into a school community. That could be at drop-off times and at pickup times, particularly in the elementary schools. That could be evening sessions in some of the middle schools and the high schools. But it's a peer-to-peer interaction, and it really is about strengthening relationships in the school community and also allowing parents to feel like they have the knowledge that they need to help their children thrive.
And they actually will set up some programs, right?
They absolutely. In some schools, they have regular weekly programming for parents. They bring in experts. Some of them are folks that work here at our health department. Some are folks that work at LACO to really help parents better understand and really strengthen their ability to navigate on behalf of their children, to be advocates for their children, and to create a community where everyone thrives.
And Dr. Duardo, I know I've heard you reference this program in meetings, and why do you think it's so important for our school communities?
And it's exactly what Dr. Ferrer said. It's a partnership. If we're going to ensure that our students are thriving and doing really well in school and in life, we can't just work with the students. We have to engage partners, we have to engage educators, and we have to engage parents. And I think there's something really wonderful about educating parents on issues that sometimes can be very challenging. I know as a parent, it's not easy, especially depending on the developmental stages that your child or children are going through. And to get educated to help you better understand how to support your child, but also to be able to support other parents. And there's something very powerful when a parent can talk to another parent who's experiencing something very similar. And there's comfort in that. And I think everybody wins. The child benefits when their parent is more engaged. The parent benefits by learning more about how they can best support not only their child, but other children in the school and how they can support other parents, and the school wins because we're all working together.
One of the things that's interesting, and Dr. Duardo, maybe you want to speak to this a little bit, is that, there are all these programs that are offered by our county departments that people don't know about. And that was part of why we were having this show today and inviting other leaders.
And that, again, talking about partnerships, besides all of us are serving the same children and families in LA County. And so what we're trying to do here at LACO, and Dr. Ferrer and many other county department heads are all on the same page, is that we need to work together and we need to share resources. We need to inform the community about the resources that are available to them. So I get regular communication from Dr. Ferrer sharing wonderful programs, whether it's wellness centers, the PAL program, the student advisory groups. During the pandemic, they wanted to have students initially to help with the messaging for masking. And it's all of us working together and getting the information out there so that you don't have, families and communities, as busy and as hard as it is, believe it or not, with all the information coming at them, we can together send that information out and share that with our own communities. We all benefit.
Well, and another example of that is the Help Me Grow program, which is that a newer program?
None of these are necessarily new programs. Some started before the pandemic and then paused. Help Me Grow, I think, started right before the pandemic. It's something, actually, I want to credit LACO and the leadership here for helping us better understand that peer-parent programs are highly effective. And here, this is another example of a peer-parent program. It's really aimed at families that have children with special health care needs. But that includes children who have special educational needs. And what it does is it pairs a parent who has experience as parenting a child with special needs with other parents who are either struggling to get services for their children or their child, or have a child that's newly diagnosed with a special need and are trying to figure out how to navigate both the educational system and the healthcare system. It's brilliant in the concept of allowing parents to reach out to other parents in communities where they live and or work. This is, again, a way, I think, about strengthening our school communities, but also, more importantly, I think it really leads to strengthening our families and allowing them to, as Dr. Duardo mentioned, know how to navigate what is an increasingly complex world, particularly if you have a child that has some special needs.
Yeah, well, and I was just thinking, Dr. Duardo, this must resonate with you personally.
Absolutely. I have an adult son who's severely disabled. And, when you're a parent and you're raising a child with special needs, it can be overwhelming. And to be able to connect with another parent who is experiencing the same thing, especially a parent who may have a child older than yours, who has already learned a lot from their own experience, and being able to connect and learn from one another and support one another is just an amazing opportunity. So when I first heard about this program, I was really excited because it's very hard. It's hard to be a parent, but it's especially hard when you have a child that has special needs. And I think it's just wonderful that you're doing this and that your teams are supporting parents and empowering them to support one another.
Yeah. And our peer parents also have access to a lot of training. So I think they're thrilled to be able to participate in the program because they're able to use their skills that they've gained navigating the world and gaining support for their children. But they also have access to a lot of training and skill building that we're able to provide them with so that they can, again, be good mentors and support for other parents that are, again, really looking for help in meeting the needs of their child.
And I think you see that across the board. Whenever you provide training and resources to parents, they're so appreciative because they grow. It helps them, with their own family life and raising their children. But it gives them the opportunity to support other parents. And, like I said, everybody wins when you have these types of programs.
Yeah, absolutely. Well, and another program that you have that, again, we share is Wellbeing Centers. You have an investment in Wellbeing Centers. I know we're firmly invested in them as well.
These are our Student Wellbeing Centers. I have to say this program means a lot to me personally. We have them primarily in about, I think, 42 high schools. Wow. And then we're also in a couple of middle schools. We'll be expanding in middle schools, again, all across the county in partnership with LACO. At some of our sites, we're also in partnership with Planned Parenthood. We're able to offer safe spaces for students at schools. We have programs embedded in our Student Wellbeing Centers that help young people learn leadership skills. We have a peer leadership program where we are able to enroll 20 to 30 children per school, students per school, and offer them a lot of leadership training. We also have programs around, again, substance use prevention, thriving, emotional well-being. We're connected to mental health resources, and we have sexual health services. Students primarily rate this, their student wellbeing centers extraordinarily high. I think they feel very comfortable there. They're supported by master level trained youth educators and senior youth educators. Again, they get to work with each other with the notion of making sure that everyone in their school community feels safe, feels supported, and can contribute to making that school great. So we're welcomed by the educators and the teams that are at the schools. LACO's been a huge supporter. Dr. Duardo has helped us really expand our footprint across the county so that we're in so many schools now. And I think it's, I encourage people to go to the sites and visit them because it's really powerful to see what a difference having a safe place makes in a young person's experience at school.
Yeah, and I think it's one of the number one things that students are asking for. You know, over the past, I'd say 7-8 years, when we're talking to students and asking them what they want and, you know, what's important to them. And a lot of what they say is their mental health and their overall well-being. And they need these spaces where sometimes they just need to decompress and they need to just step away from the anxiety they're experiencing in a classroom or a challenge that they're facing. And they can go and they can talk to a peer or they can talk to a counselor if that's necessary, or get any of the other resources that are offered. And it really is beautiful when you go to these spaces, just stepping in, you kind of feel a sense of like, oh, okay, I get it. This is a safe place where people can come in and feel accepted and a sense of belonging.
And students that come in also, you know, again, have access to skill building. You know, it's very easy for us to say, you know, students shouldn't fight, they shouldn't bully, but students actually need a toolkit. They need to learn how to manage their emotions, how to manage their relationships with others. And that's what happens at the Student Wellbeing Centers. There's an opportunity there for students to learn skills that help them have healthy relationships, that help them be accepting of each other and accepting of themselves, that help them know how to access resources, that really give them accurate information about the dangers of using illicit drugs. And also what comes up over and over again is managing relationships in their families. So another component of the Student Wellbeing Centers is we do work with families and parents and offer a lot of workshops for parents. Particularly important is, you know, we're parenting teens. The young people are changing. It's important to understand what changes they're going through, both physically and emotionally. And parents have loved the opportunity, again, to be primary in the role with their child around providing that kind of safety and security.
It's just wonderful that we have these things for, I mean, we used to not even know that it was a thing, and now we're so focused on it. It's awesome. And the last program I'm going to ask you about is your Peer Health Advocate program. It's another one that you have going. Can you tell us a little bit about it?
Yeah, the Peer Health Advocate program is embedded both at the Student Wellbeing Centers, but it's also something we offer at schools that don't have a Student Wellbeing Center. The model there is for young people to learn skills. This is, again, around really figuring out how they can thrive and how they can understand both themselves and the community in which they're living. We train young people around recognizing signs of substance use disorder. We train young people in healthy relationships. We allow young people to serve as mentors in their school to other young people in their schools around issues that are of importance in that particular school community. In many of our school communities, protecting the rights, particularly of trans youth, but also of the LGBTQ plus community, has been a big issue on the campuses. And young people have taken a leadership role in figuring out, how to build their own skills around recognizing bias and really striving to create healthy relationships with everyone.
Well, and I know that you must feel strongly about this, given this is really part of your message with your students of how they can be leaders and help other students.
Yeah, I mean, absolutely. I think what's really amazing is when you visit these sites and you talk to the students and you see how each site is a little unique. And I love hearing from the students as far as how they're solving challenges. Right. How are we making sure that students are aware of the services and the programs that are offered here? How do we make them feel like this is a place where it's okay to come into, that we're going to maintain confidentiality? All of these things, when you talk to students who are actually doing the work and you hear the different activities that they're planning to ensure that students know that they're welcome to come and get support, it's pretty incredible. I always say, if you want to really solve a problem, just talk to youth, because they are brilliant and they come up with ideas that sometimes we as adults may not think of.
Well, and I have one final question for each of you. And Dr. Ferrer, for you, a lot of our district leaders, our school leaders, they want, healthier, stronger communities. What would be your advice to them?
I think one thing is, I want to give a lot of credit to school leaders. They have an extraordinarily challenging job, and they've got to meet the needs of students with various learning styles and various emotional needs. I do think making sure that we're paying attention to the physical and emotional health of students is probably paramount. Young people really can't be successful learners if they're struggling with health issues. So somehow creating space, I know there are a lot of demands on how to use time effectively at school, but creating space at school where young people can in fact learn skills about managing their emotions, managing their relationships, connecting them to support as they need support, recognizing that young people have an important contribution to make in structuring that school community. Those are all strategies that many schools are already embracing, but I think make a huge difference in the ability of the young people we're in service of to thrive.
Thank you. And Dr. Duardo, as you mentioned,
I could just say ditto, because everything she said is absolutely on point. But I think just listening, and as you said, be observant, connect with the students that you're serving, because students can tell immediately if you're genuine, if you care, if you love them, and you're taking care of them. And I think that the number one thing you have to do is you have to have a good relationship with each student that you're working with, where they feel seen and heard and respected. So I think if you start there and you're student focused, everything after that is secondary. But, having that kind of connection and care for the students you're serving.
Well, I always love talking to both of you because you're so student focused and it's so about their well-being and caring about them. So thank you for being here. Thanks, Dr. Ferrer and Dr. Duardo, for joining us today. We hope this show helps connect you to the resources that can make a difference. To learn more about the programs mentioned, visit our website at www.laco.edu. I'm Elizabeth Grasswich. We'll see you next time on EdBuzz.